Hi, I'm Dr. Baker, and I've been Red Yoder's PCP for 30 years now, and I'd say I know him pretty well. He has had a hard couple years since his wife Debbie passed 10 years ago, and his age has been slowly catching up to him. But these past 6 months have been particularly difficult with the diabetes diagnosis and his recent hospitalization for sepsis. As Red's PCP, it's my responsibility to monitor and coordinate care for all aspects of Red's health, including physical, mental, and social health. But I'm only one person, and he needed a lot of support following his hospitalization. I had Red and his family come in for an appointment the day after he was discharged so we could debrief and make a plan together. After defining his values, we decided a good place to start would be with a team of an occupational therapist, home health nurse, and a case manager to help him achieve his health goals. I reassured him that we would all be working together and communicating regarding the direction of his care and to tailor it to his unique patient circumstances and preferences. But when Red told me he didn't understand why his blood sugar was elevated, even though he wasn't eating, I realized that my initial patient education must have been lacking. So I thought it prudent to involve a health educator to help me enable Red with the knowledge to take better charge of his health. In chatting with Red and his family, it became apparent that the strain between him and his son John and his wife Judy had worsened since I'd last seen them. I acknowledged the stress of the situation and asked if counseling would be something any of them would be interested in. After some deliberation, Red expressed that repairing his family dynamics was a priority to him, and so I got him in touch with a therapist at the VA. I scheduled weekly appointments with Red for the first 4 weeks to monitor his healing diabetic foot ulcer and tongue lesion, and to gauge his perspective on how things were going. Red shared that having his bandages changed on his foot during the morning caused him some pain and impacted his ability to work with the OT later in the day. I communicated these concerns with his home health nurse, who came up with a solution to changing his bandages after OT each day, which allowed him to participate more fully. Now, enough about my role. I want you to hear from the other members who are integral to Red's recovery.
I'm Itza, and I'm Mr. Yoder's home nurse. I call him Red now since he felt more comfortable being addressed by his nickname. I visit him 4 times a week, usually during weekdays, and for about 8 hours each visit. My role in his care involves assisting him with his meals, medications, exercises, moving around his home, and keeping him company. As a nurse, I'm able to assess any changes in his cognition, physical changes, and other health factors. I communicate regularly with his son, John, his OT, PCP, PT, all about his progress and challenges. Something that was important to Red was his autonomy as a patient. He made it clear to me that he didn't want to burden his son John, and he didn't think I needed to be there as often as I am. I assured him I was not his babysitter, and my role is to assist him and John in improving his health and ensuring his safety. I met with his PCP recently, and we reconciled his med list. I helped them pick out a pill box that would fit Red's needs. The pill box has huge lettering, is easy to open, and has an alarm to remind Red when to take his medications. I let him choose what activities he wants to do, as well as in the order he wants to do them, so he feels involved in his care. I help educate him on his diabetes, and we have worked together to set a meal schedule so he's no longer skipping meals. I update his son regularly, and I've seen a big difference in their relationship. To ensure efficient communication with his entire health team, we communicate in an open email thread and send our summaries and handoffs. It has been so helpful being able to know exactly what Red is doing with other members of his care team, and I'm able to implement their recommendations almost immediately.
Hi, my name is Tanvi and I am Red's OT. As his OT, I worked with Red to evaluate his IADLs, ADLs, fine motor skills, and cognition. I also worked with PT to evaluate Red's gross motor function. After evaluation, I spoke with Red about what his goals were, and his first statement was that he wanted to maintain his independence and reduce the burden on his son. I counseled Red on how, as an OT, I can help him utilize adaptive technology like transfer benches that would allow him to improve his safety and healthcare at home, and that this would not cost too much for his son. I also spoke with the home nurse and PCP after each session to share Red's ability to care for himself and improvements in using adaptive strategies. I also spoke with Red's caseworker on Red's weekly progress as well as any safety issues that may be present in the home. Prior to each of Red's sessions, I would work with PT, nursing, and the PCP to determine if there were any adjustments that needed to be made to the plan and how the assistive technology was being utilized. To ensure effective communication, I also send out detailed clinical notes to the care team and a copy of these notes in layman's terms for Red and his son. Additionally, I meet with Red, his son, and his son's wife to discuss the treatment plan and provide them all with regular opportunities to discuss the plan and any concerns they may have. Finally, as Red indicated in his first visit with me that he has difficulty when instructions are given verbally, and his son stated he was frustrated because Red sometimes is unable to follow medical instructions, I'm providing both of them with detailed written instructions after each visit as well as progress steps. Once Red completes inpatient OT sessions, I'm going to provide a referral for home OT services as well as work with the healthcare educator to find other care programs to address dietary needs and reduce the burden on Red's son.
Hi, my name is Carson. I'm the certified health educator who's been taking care of Red. As a health educator, I've been managing Red's health conditions through education, consultation, and most importantly through teamwork. I'm focusing on two main problems. Those are his diabetes and his nutrition. He was diagnosed with diabetes just 6 months ago and his doctor just prescribed him insulin. My goal is to get to the root of the problem of why he is unable to follow his medication regimen. There are many reasons why older adults do not adhere to these medications. Some common ones include forgetfulness, lack of understanding, and complex dosing schedules. I'm going to assess what Red knows about his medication and why he thinks it's important to him, if at all. I can then tackle the problem by possibly providing a more simple dosing schedule or education on why adherence is important. Secondly, to address his nutrition, I've been focusing on lifestyle habits. I address his alcohol consumption. I'm aware he has a couple beers frequently at night to help him sleep. Beer is very high in carbohydrates and can have a detrimental effect on blood sugar. I have consulted with the home health nurse on getting him set up with a glucometer so he can track his blood glucose. I'm going to educate him on adverse effects of alcohol and diabetes and possibly provide some examples with a new glucometer. His hometown also hosts a local farmers market. I've been encouraging him to shop there to maintain a healthier diet. This will hopefully promote some physical activity as well, which is the next problem I look forward to addressing with Red.
Hello, I am Julia, Red's case manager from the Kirksville VA Clinic. As a social worker, my role is to help improve Red and his family's overall well-being by connecting them with community resources. Working at the VA has taught me the importance of asking veterans about their military experience. Red shared with me details of his worst and best days while serving, which has allowed me to build a connection with him and gain his trust. I have also been working extra closely with Red's therapist at the VA, as well as his sleep specialist, to implement some of the changes they recommended in his home setting. Not only do I serve Red, but also his family because they are a large part of his day-to-day experiences. I really appreciate that his son John felt comfortable sharing with me that he feels overwhelmed and is struggling financially. He also talked about how his wife Judy has had to take complete care of Red and watch the kids. Since then, I have coordinated free transportation to and from all of Red's appointments and signed him up for the Missouri Supplemental Food Program, which distributes food to senior citizens, and they provide nutrition education, which is great to address Red's diabetes. Additionally, I made it a priority to assist John and Judy with applying for financial assistance programs. By receiving some extra assistance, this reduced Judy and John's additional stress that was contributing to them feeling on edge. I'm also working on organizing a local caregiver support group for John to attend. Overall, I look forward to continuing to work with Red and his family and to find resources that fit their needs.